So, I welcome you back, dear students. Today we are going to see one of the topic from tablet chapter, which is very important. That is tablet ingredients or excipients. Now, before we proceed further, I want to ask you people a question. That is, why we add excipient in any kind of dosage form? Why we have to add these questions? Why we go and add excipient? Anyone?
Like to make the dosage form taste good in order to increase its flavor or color, like for appealing, like it's appealing to the eyes, no? That's why.
Okay. Now, first to understand this, why we add excipient in any kind of formulation, first we should know what excipients are. So, excipients are the agents which are used in a formulation or in a dosage form apart from the API or the APIs. So, apart from drug, whatever the substance which you add into a formulation, they are called as ingredients or they are called as excipients. Make this clear into your mind. Now, why these excipients are added? Now, these excipients are added to provide a certain type of function. Now, these certain types of functions includes, it can be masking of taste, it can be masking of odor, okay, it can be ease in flowing of powders, it can be giving a suitable color to a formulation, and depending on the type of excipient, the function or the functionality which an ingredient or an excipient is going to give in the formulation, these excipients are classified into various types. Now, why they are used? It can be for masking. It can be for making the formulation stable. It can be used to have a functional coating. Okay, you can have a good color. You can have a good flavor. So all these things can be done with the help of the excipients. Now, in today's discussion, what we are going to see is we are going to see the various types of excipients which are used in tablets, and then we are going to see the examples for this excipients in detail one by one. Now, this today's chapter is very important with respect to the competitive exams which are there for pharmacy. For example, when we talk about GPAT, many a times a question is asked on the excipients which are used in tablet, mainly the diluents, which is the first class for the tablet ingredient or excipients. So with this, let's move towards a further discussion. So firstly, as we have just seen, what do you mean by tablet ingredients or what are tablet excipients? So these are the agents which are added into a tablet formulation apart from the API. So it includes firstly diluents. Now these diluents, they are also known by another name, that is fillers. So whenever we have the dose of a drug which is less, so that if where the drug dose is less, so that time what we have to do is we have to increase the amount of the bulk of the whole tablet, means we have to increase the bulk of the whole tablet formula. So this is done by what? This is done by an agent which will be giving the bulk to the tablet formulation. So normally when the dose is very low, that time we use diluents, that is diluents are used, and this will give the bulk to the tablet formulation. They are also known by another name, that is fillers. Then we have example of binders and additives. Now you may see some of the tablets, they have more hardness as compared to the tablets which are effervescent in nature. Now this is due to the amount of binder or the adhesives which we add into a tablet formulation. So the second type of tablet ingredients or excipients, it includes the binders and the additives. Then we have disintegrants. Now disintegrants are the agents which will break down the tablet into the particles. So it can be larger particles or smaller particles, because until and unless the drug which is present in a tablet formulation, it has to first disintegrate, then it will come into solution form. So only when the drug is in a solution form, it will be getting absorbed into the systemic circulation. Then the next type of excipients are known as lubricants and glidants. Now this is a class where we have, for example, when you talk about glidants are the agents which increase the flow properties of the powder or the granules. Or when we talk about lubricants are the agents which are used or which are applied on the tooling of the tablet, so that the wear and tear of the machine is less, as well as the defects which are seen in the tablets will not be seen. Then we have another class also, that is anti-adherents, which we'll be seeing in the further discussion. Then the other types of excipients includes the coloring agents. So all of you like colors, you can have tablets of various colors. Okay, we can use only those colors which are approved by the FDA, that is Food and Drug Administration. Then the flavoring agent and sweetening agents. So there are other type of excipients also which are added into a tablet, but the major type of excipients which are used generally in the formulation of tablet, we have seen the examples for them over here. Now which type of ingredient or excipients we have seen? Just we'll have a recap of that. That is diluents, or they are also called as fillers. Then we have binders and adhesives. Then the third class is of disintegrant. Then we have lubricants and glidants. Then coloring agents, flavoring agent, and sweetening agents. Now let's move to see which type of functions these excipients provide. Now at the early part of the discussion, I told you that excipients will be giving you it will be providing you a certain type of function. Now which are those functions we are going to see one by one. If I want to put this in very simple terms, I can put in such a way. These are just like the masalas which we use in our kitchen. Now suppose if I want to prepare a curry which is more spicy in nature, so which type of ingredient from the kitchen I am going to use? Yes, students? Which type of ingredient
Chili
I am
powder.
going to use? So I am going to use chili powder. So is the chili powder the only option with me? I can use anything which is spicy in nature. So for that, firstly, I should have a good knowledge of the excipients which are with me. So when we use any kind of excipient in tablet dosage form, the first and the most important thing is that it should be approved by FDA. So this point I will first tell you, that is, it should be approved by the regulatory agency where you are going to market the formulation. So in short, it should be approved by the FDA. If it is a regulatory market, that is Food and Drug Administration. Now coming to our main discussion, what are the functions which an excipient will provide? So let's see these functions one by one in detail. So they can impart weight, okay, the accuracy and volume. So imparting weight is done by diluents. We use diluents such as lactose. Then accuracy, as we know that tablet is in solid unit dosage form. So the accuracy by which the drug dose is delivered is more in tablet dosage form as compared to other dosage form, mainly the liquid dosage forms. Okay, as well as the volume can be imparted with the help of the excipients which are used in tablets. Then it can be also used to improve the solubility of a drug. It can increase the stability. If I want to make my product stable, or I want to increase the shelf life of my product, and if I know that it is more prone to oxidation, so I am going to use such a kind of agents which are going to protect my API as well as the other ingredients from the in the formulation from the oxidation process. So that time I am going to use antioxidant into my formulation. So the excipients can also help in increasing the stability of the tablet dosage form. Then it can enhance the viability. So we can use certain types of excipients which will be helpful in increasing the amount of drug which is reaching the systemic circulation. It means the rate and the speed, that is the rate and the amount at which the drug is going into your systemic circulation, that is blood, will be enhanced by certain type of excipients. So these are the functions which excipients provide. Then also you can modify the drug release, means you can play with the release pattern of the drug when you talk about excipients. For example, we have just I will give you an example. We have HPMC and we have ethyl cellulose. So these two polymers, they are totally different sides. So one will be used for sustaining the action, one will be used for delaying the action. So this is what we should know. So we can modify the release pattern of the drug by using certain type of excipients. Then so these excipients, they also assist in the product identification. Now for example, if you are using a suitable type of color, okay, so that color can be an identification mark for your product. Then we have next point, that is it can also be used to increase the patient acceptance. It can also be used to increase the patient's acceptability. Now acceptability means when the acceptability for dosage form is more, it means the compliance of the dose will be more. So the more compliance rate will be there for the dosage regimen. Then the other function includes it facilitates the dosage form design. So by using certain types of polymers, we can convert, by using certain type of excipients, we can convert a drug into a medicine. Just first try to keep this very thing into your mind, that what is pharmaceutics. For example, when we convert, let me go to over here. When we convert this API, that is drug, into a medicine, okay. So the study which deals with conversion of a drug into a medicine is called as pharmaceutics, in very simple language, okay. It means what? Now tell me, this medicines means what? This medicines means these medicines are dosage forms. So which are those dosage forms? So these dosage forms can be your tablet, your capsule, emulsion, suspension, anything, okay. So do you find always that we give the drug as it is? Now suppose if I have a drug called as paracetamol, so directly do you give 500 mg of paracetamol to a patient, or do you give 125 mg of paracetamol to the children's? No. So what we do, you add certain excipients. So drug plus excipient will lead to a certain type of dosage form. Now let me make it more clear with the help of picture. So what will happen? You are going to have a drug plus excipient will be there. So drug plus excipient will be giving you what? they will be giving you a dosage form. Fine. So is it clear to everyone up to this point? Hello.
Yes, sir.
Okay. So is it, so we should be very clear into our mind what are these excipients. These excipients will be performing a certain type of role or function. Okay, now suppose if I want to protect my drug from oxidation, so I am going to use such a kind of agents which will prevent the oxidation. They are called as antioxidant. Okay, so that is what firstly we should know what role they can play into any kind of formulation. First we should know, then only we can understand this in detail more. Now coming to the first class from the for the additives which are used in tablet dosage forms, first class is of diluents. Okay, ही slide दिसते का सगळ्यांना? I hope everyone can see this slide. Hello.
Yes, sir.
Okay. So who's going to read the definition for diluents for me?
So should I?
Give other students also chance. Let me see whether they are attentive or not. Chalo.
Diluents,
Huh. Come on.
diluents are fillers used to make required bulk of the tablet when the drug dosage itself is inadequate to produce the bulk.
Okay. So firstly, whenever you study any drug in cognosy also, the first thing what you study is the synonym, the other name. Okay. So the synonym for diluents, what they are? Fillers. Okay. Now why they are called as fillers? Okay. Now they are called as fillers because whenever we have a drug dose which is less, okay, so to increase the bulk of the tablet, what we are going to do, we are going to add such a kind of agent which will give the bulk to the tablet, and that's the reason they are called as fillers. So it is going to fill the required amount of drug which is required to make the bulk of tablet. Okay, so what is done, as the dose of the drug is less, so to have a specific bulk, what we are going to do, we are going to use certain type of agents, and these agents hence they are called as fillers. So whatever the weight which is required to have a sufficient bulk in a tablet dosage form, okay, that is done by the diluents. Okay, so they are filling that much weight, hence they are called as fillers. And normally you will find we use diluents when drug dosage form itself is inadequate to produce the required bulk. Then the second reason why we go and add the diluents or the fillers is mainly as these diluents and fillers will provide better tablet properties such as improve cohesion, also to permit use of direct compression manufacturing, or to promote the flow of the blend. So the first thing is when the dose is less, this is the primary reason why we go and add diluents or the fillers. The second reason is that when we want the tablet properties in such a way, so when I want my tablet to be more cohesive in nature, that time also I am going to use diluents. If I want to directly go for direct compression method by which I am going to prepare my tablet, that time I can use diluent. And also if I want to increase the flow of the blend of the powder which I am going to use for tableting, so that time also we can use diluents. Now these are below, we have certain properties which an diluent should have, and it includes that the diluent should be non-toxic, and it should be having a low cost. Now they must be commercially available as well as in acceptable grade. In general, the point I have not mentioned over here, they should be approved by regulatory agency. So the first point is that they should be approved by the regulatory agency. Now acceptable grade means, see, whenever we take tablet, we take normally the tablet is taken by oral route many a times. So the excipient which you are going to add, they should be GRAS certified. That is generally regarded as safe. So it should be GRAS certified also. In short, what I am telling is that they should be approved by the FDA, that is Food and Drug Administration, and they should also be GRAS certified, that is generally regarded as safe. Then the other properties, they must be physiologically inert, then physically as well as chemically stable by themselves, okay, or in combination with the other drugs. So in short, they should be compatible with the other ingredients which are present into the formulation. They should be physiologically inert, physically and chemically stable, not only for themselves but also when they are used in combination with the other drugs for dosage form. Then they must be free from all microbial contamination. So no microbial contamination should be there. Then they should not alter the viability of the drug. So in short, they should not hamper the viability of the drug, and they must also be compatible with the color. So these are the properties. So we can say these are the properties which an diluent should have, but it's not possible to have a diluent which will have all the properties fulfilled 100%. Now coming towards the next point from the diluents, that is the ideal characteristics of the diluents. Now when we say that it should be physiologically inert, it should be chemically as well as chemically stable, okay, it means it should be non-toxic. So the ideal property for diluents firstly includes that it should be non-toxic, it should be acceptable by the regulatory agencies in the countries where the product is going to be marketed. So as I told you in the earlier slide, that the first and the most important criteria for any type of excipient which you use, not only in the tablet dosage form but any type of dosage form, it should be approved by the regulatory agencies in the country where you are going to market this final dosage form. Then they must be commercially available in the acceptable grade in all the countries where you are going to manufacture the product. So the commercial availability of the various grades of excipients which you are going to use, it should be available in the countries where you are going to manufacture this product. Then they must be cheap compared to the active ingredient and must be physiologically inert. So these are the ideal properties. As I told you that we can't have a single excipient which will be meeting all the properties or the ideal requirements which are required for a particular category of an excipient. Now they must be chemically stable alone or in combination with the drug or other tablet components, okay. They must be color compatible and should not produce any off color appearance. Many a times what happens when you use a certain type of diluents, they will lead to discoloration or color changes in the blend of the powders. So should not produce any off color appearance when they are used into a formulation. And the most important part is that they should have no negative effect on the viability of the drug product. So they should not hamper in any way the overall viability of the drug, that is the rate and the extent. Now rate means speed, extent means amount of the drug which is going to come into the systemic circulation. So these are the ideal properties of the, this should be the ideal properties of the diluents. Now moving further, this is a very important slide. So I request everyone to please take a screenshot of this slide. I am also taking, okay? So I am also taking a screenshot of this slide. Now the basic reason why I am taking telling you people to take the screenshot of this slide, because many a times whenever a question is asked, mainly on the that is the diluents which are used in tablet, 95 times the question is mainly asked on the diluents, and that is on lactose. What do you mean by Maillard reaction? What is lactose? What do you mean by anhydrous lactose? What do you mean by hydrous lactose? And so on. Okay. So first, let's see the commonly used tablet diluents. So the first one is lactose anhydrous, and then we also have a second type of lactose that is called as spray dried lactose. So lactose can be in two forms. One is hydrous form, second one is anhydrous form. Then the second example for diluent is directly compressed starch. So that this directly compressed starch, which is known by a brand name that is Star RX 1500. So this Star RX 1500 is a directly compressible starch which can be used in the tablets which are prepared by direct compression method. Then we have a different class of diluents which are called as hydrolyzed starch. So again they are from the carbohydrate categories only, where we have two brand names which are used largely. One is MDAX, that is EMDEX, and second one is Cellutab. Now Cellutab means, as I told you, they are from the carbohydrate category. Cellu means it is cellulose. So this is cellulose. Okay. And then we have tab means it is used in tableting. So that is the name. That is the reason the name is given as Cellutab. Then we have microcrystalline cellulose, okay, which is having a brand name that is Avisil. Now it is available in two grades, that is pH 101 and second one is pH 102. Then the another type of diluents which are used in tablet, it includes diabasic calcium phosphate dihydrate. Then we have calcium sulfate dihydrate. Then the sugars such as mannitol and sorbitol. Then from sugar category, that is from mainly from the sucrose category, we have sugar tab, then dipac or new tab, and we can use dextrose also as an diluent. So I hope everyone has taken a screenshot of this list of the diluents which are added in tablet dosage forms. घेतली सगळ्यांनी? Hello.
Yes, sir.
Yes, sir.
Okay, how much time we have with us for lecture? I think so another 15 minutes or 10 minutes.
12 minutes.
Okay. So now again coming to the important point, where in my view, even when I gave therefore in my time we used to have GATE examination. So when I wrote the exam for GATE examination, this question was also asked. That is, what do you mean by Maillard reaction? Okay. Which type of lactose is used in the formulation of tablets largely, and why? So So certain types of questions are asked on frequently, mainly for the competitive examination. So it becomes easier whenever we have guidance. So please study in detail the whole thing regarding lactose. So even though something is going to miss from my side, you can read the textbooks and cover the things. Now let's see about lactose in detail. So lactose is the most widely used diluent for the tablet formulation. So as we have seen, it is one of the most widely used diluent in the formulation of tablet. And now this lactose is available in two forms. First one is hydrous and second one is the anhydrous form. Now why it is very important for us to know that which form plays which properties, or which form is having what type of properties present into it. Now the anhydrous form, it has a tendency to pick up the moisture when exposed to the elevated humidity. So when you are going to use an anhydrous form of lactose, it has a tendency to pick up the moisture when it is going to be exposed from the at the elevated humidity. Now when we have certain type of conditions in the tableting, that time what we have to do, we have to pack. So the such tablets, they have to be packed in the moisture proof packets or in the containers. So we have to be careful while selecting the containers when you are going to use anhydrous form of lactose. Then when you are going to employ a weight granulation method. Now where weight granulation means, normally you are going to use a solvent which is liquid in nature. Water is used on a larger scale, but we can use other solvents also, okay, is employed. That time the hydrous form of lactose should be used in general. Now why? Because it will not pick up the moisture. Then the two commercially available grades for lactose, it includes firstly a 60 to 80 mAs, which is a coarse lactose, and second one is a 80 to 100 mAs lactose, which is of regular grade. So these are the two types of grades which are available for lactose. Clear? Okay. So moving further regarding lactose, now let's talk about the advantage and disadvantage of lactose in detail. So this is the point which is very important, which we are going to see in detail. Firstly the advantages and then the disadvantages. Fine. So I assure you, if not in the competitive exam, but this question will be there into your final exam, or there are chances that this question will be there specifically on diluent from this first example lactose. There will be a question at least in final exam or in GPAT, or it can be coming in both of the examination. So it is very, very important to study in detail regarding lactose. So let's talk about the advantages of lactose. Now why lactose is used as one of the most favorite, we can say, diluent in tableting. So this lactose has no reaction with most of the drugs. So in short, what we can say, the compatibility of this lactose is wide and it is comfortable with most of the excipient as well as the drugs. So no reaction with most of the drugs, whether it is going to be given in the form of hydrous or in the anhydrous form. Then the tablets which are prepared by using lactose as a diluent, they have a good release rate. So the release rate does not get affected, okay, You can see the repeatable pattern of the formulations where you are going to use lactose as a diluent. Then the next advantages of lactose includes the granulations which are prepared by using lactose. They are readily dried, means they easily get dried, and the disintegration time of the lactose tablets are not strongly sensitive to variation in the tablet hardness. So even though if there is a variation in the tablet hardness, okay, the tablet disintegration time which are prepared from lactose are not strongly sensitive in the changes or in the variation in the tablet hardness. And the most important thing is it is a low cost diluent. So these are the reasons why which make lactose as an favorable diluent in the tableting. Now coming to the disadvantages. My dear students, please pay attention over here. I am discussing a very important point, that is what do you mean by Maillard reaction. Now this Maillard reaction you may have studied in biochemistry, but the point which I want you people to understand over here. So whenever you use a lactose, okay, now this lactose, when it is used, it is mainly used as a diluent in a tablet. So this lactose will react with the amine drug bases. So it will react with which? The amine drug bases. Can anyone give me the example of amine drug bases? It means it will have a amine group into it. काय राहणार त्याच्यामध्ये? Amine group. म्हणजे काय राहतो? Nitrogen. What do you mean by amine? Can anyone tell me?
NH2 group.
So it is NH2 group. Okay. Now normally what you will find, the valency for nitrogen is how much? It is 3. किती असती? 3 असते. Okay. So this is amine group. Okay. Now suppose if I want to draw this it in more clear picture, it will be in such a way. So this will be H over here. This will be H. Okay. So it can be a group over here. So it can be anything over here. So this is your amine group. Okay. So lactose will react mainly with the drugs, those are going to have a amine drug basis. Okay. So the drugs which have the amine drug basis, and specifically it is shown mainly when you have alkali or alkaline lubricants. So when you are going to use lubricants such as magnesium stearate, which is example of a metal stearate, it will lead to the gradual discoloration of the powder blend or the tablet. It means what will happen? It will lead to a formation of dark brown color. With time, with storage, you will find the color changes of the lactose when you are going to use drugs which are amine bases, and this happens only in presence of metal stearate such as magnesium stearate, where the color changes to dark brown with time. And the basic reason why the color, there is a discoloration, that is the dark brown color is seen, is due to a formation of fural aldehyde. So this everyone should know. So what is the basic reason why there is a color change or discoloration? There is a formation of fural aldehyde. Is it clear to everyone? So what we can say? So when lactose, it reacts with the amine drug bases in presence of alkaline lubricants such as metal stearate, example is of magnesium stearate, it leads to gradual discoloration of lactose or the tablet dosage form, which will change the color to dark brown. Okay, and this is due to the formation of a compound that is fural aldehyde, and this whole thing is called as Maillard reaction. Okay, so there is a reaction. What is done? So this is, we have lactose is reacting with the amine bases of drug in presence of metal stearate. Okay, this is your product, that is a dark brown product you are getting, that is discoloration. Okay, and this dark brown color is due to what? As when lactose react with amine bases in presence of metal stearate, it leads to a formation of furaldehyde, and this formation of furaldehyde is responsible for what? It is responsible for the discoloration of your tablet, and the color which is seen, it is dark brown, and this whole thing is called as Maillard reaction. I hope that you people have understood this. Hello.
Yes, sir.
Sir,
काय होतं समजतंय तुम्हाला याच्या मेलार्ड रिॲक्शन मध्ये? लॅक्टोज कशासोबत रिॲक्ट होणार आहे? अमाइन ड्रग बेसिस
amine.
in presence of alkaline lubricants such as metal stearate, means mainly in presence of amine drug bases when lactose react, and this is seen when you are going to use metal stearate such as magnesium stearate, where so when they react with one another, there is a formation of furaldehyde. Now this formation of furaldehyde will be responsible for the discoloration of your tablet. Okay, and this discoloration will be seen with the in the color form of dark brown color. Okay, and the reaction is called as Maillard reaction. Okay, so normally this question is asked, which excipient shows Maillard reaction. Okay, so this is what we can say. So this is the one of the approaches that we can use anhydrous lactose many a times, so that the Maillard reaction is not seen, or we can avoid using magnesium stearate when you use lactose as a lubricant. Means when you use lactose as a diluent, sorry, we have to avoid using magnesium stearate as an lubricant. So this problem of Maillard reaction can be solved. So with this, we'll stop over here, and the